Human metapneumovirus, or HMPV, is a respiratory virus that primarily affects the lungs and breathing passages. It might not be as well known as the flu or the common cold, but it's just as important to understand, especially after the recent outbreak in China. In this video, we will dive into everything you need to know about this virus, from what it is and how it is transmitted to its symptoms and treatment options. We will also take a look at what's happening in China and what we know so far. By the end, you'll have a complete understanding of HMPV and how to protect yourself. So, without any further ado, let's get started. What is HMPV? HMPV is a respiratory virus that causes symptoms similar to the common cold or flu. It was first discovered in 2001 in the Netherlands, which is relatively recent compared to other viruses like the flu. What's interesting about HMPV is that even though it was only discovered recently, researchers believe it has been infecting humans for at least 50 years. The virus primarily targets the respiratory tract, which causes symptoms similar to the common cold, including coughs, fevers, and nasal congestion. However, in vulnerable populations such as young children, the elderly, and those with compromised immune systems, it can escalate to much more severe conditions like bronchitis or pneumonia. HMPV is particularly sneaky because it can infect the same person multiple times throughout their life. Your immune system develops some protection after the first infection, but this protection isn't complete or permanent, which is why you can get infected again. How HMPV spreads. The virus spreads through close contact with infected people, similar to how a common cold spreads. When someone with HMPV coughs or sneezes, they release tiny droplets containing the virus into the air. You can get infected by breathing in these droplets or by touching surfaces contaminated with the virus and then touching your face. The virus can survive on surfaces for several hours, which is why good hand hygiene is so important. It's particularly common in crowded places like schools, daycare centers, and nursing homes. The virus tends to be more active during late winter and early spring, but you can catch it any time of the year. It's worth noting here that HMPV belongs to the same family of viruses as respiratory syncytial virus, which is another common cause of respiratory infections. Symptoms of HMPV. When you get infected with HMPV, you might not feel the symptoms right away. The virus typically takes 3 to 6 days from exposure to cause symptoms. When they do appear, they can range from mild to severe, depending on your age and overall health. In most healthy adults, HMPV starts with a runny or stuffy nose, a sore throat, and a cough. These symptoms are often mild and can be mistaken for a regular cold. However, as the infection progresses, the cough may become more persistent and severe, sometimes leading to wheezing or difficulty breathing. Some people also develop a fever, which can range from mild to high, depending on the severity of the infection. The cough caused by this virus can be particularly annoying and might last for several weeks, even after other symptoms have improved. In more severe cases, HMPV can lead to lower respiratory tract infections, such as bronchitis or pneumonia. Symptoms of these conditions include a deep, chesty cough, shortness of breath, and a feeling of tightness in the chest. Infants and young children may also experience irritability, poor feeding, and lethargy. In older adults or people with weakened immune systems, HMPV can cause more serious complications, such as respiratory failure or worsening of existing chronic conditions. It's worth noting that HMPV symptoms can overlap with those of other respiratory viruses, like RSV or the flu. This can make it difficult to diagnose based on symptoms alone. If you or a loved one is experiencing severe or worsening symptoms, it's important to seek medical attention. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to share it with your family and friends. You never know who might need this information. Diagnosis of HMPV. Diagnosing HMPV can be tricky because its symptoms are so similar to those of other respiratory viruses. However, there are specific tests that can confirm an HMPV infection. Here's how it's typically done. If your doctor suspects HMPV, they may take a nasal swab or throat swab to collect a sample of respiratory secretions. This sample is then sent to a lab for testing. The most common test used to diagnose HMPV is called a polymerase chain reaction test. This test detects the genetic material of the virus and is highly accurate. Results are usually available within a few hours to a couple of days. In some cases, your doctor may also order a chest x-ray if they suspect pneumonia or another lower respiratory tract infection. Blood tests might be done to check for signs of infection or to rule out other conditions. While these tests can't specifically diagnose HMPV, they can help your provider get a clearer picture of your overall health and the severity of your illness. Treatment for HMPV. There's no specific antiviral treatment for HMPV, but most people recover on their own with supportive care. The goal of treatment is to relieve symptoms and prevent complications, especially in high-risk individuals. Let's explore the different treatment options available. Number 1. Over-the-counter medications. Some over-the-counter medications can help relieve some of the symptoms of HMPV. For example, acetaminophen or ibuprofen can reduce fever and ease body aches. Cough suppressants can help with a persistent cough, while decongestants can help clear a stuffy nose, but they shouldn't be used for more than a few days as they can cause rebound congestion. It's very important to avoid giving cough or cold medicines to young children without consulting a doctor. Number 2. Humidifiers and steam. Using a humidifier or taking a steamy shower can help ease congestion and make breathing more comfortable. The moist air helps loosen mucus in your airways, reducing coughing and wheezing. If you don't have a humidifier, you can also try inhaling steam from a bowl of hot water. Just be careful not to burn yourself. Number 3. Nebulizers or inhalers. For people with asthma or other respiratory conditions, HMPV can trigger wheezing or difficulty breathing. In these cases, a healthcare provider may recommend using a nebulizer or inhaler to deliver medication directly to the lungs. These medications help open up the airways and reduce inflammation, making it easier to breathe. Number 4. Rest and hydration. One of the most important things you can do when you have HMPV is to rest and stay hydrated. Your body needs energy to fight off the virus, and getting plenty of sleep helps your immune system work more effectively. Drinking fluids like water, herbal teas, and broths can help keep you hydrated and loosen mucus in your airways, making it easier to breathe. Number 5. Hospitalization for severe cases. In severe cases, especially in infants, older adults, or people with weakened immune systems, hospitalization may be necessary. In the hospital, patients can receive oxygen therapy to help with breathing, intravenous fluids to prevent dehydration, and other supportive treatments. In rare cases, mechanical ventilation may be required if the patient is unable to breathe on their own. Prevention of HMPV. Preventing HMPV infection involves many of the same strategies we use to prevent other respiratory viruses. Good hand hygiene is crucial. Wash your hands frequently with soap and water for at least 20 seconds, especially before touching your face or eating. Avoid close contact with people who are sick, and if you're sick, stay home to avoid spreading the virus to others. Regular cleaning and disinfection of frequently touched surfaces can help reduce the spread of the virus. During peak seasons, you might want to be extra careful in crowded places, especially if you're in a high-risk group. Recent outbreak in China. In early January 2025, reports emerged of a surge in respiratory illnesses in China, with hospitals reportedly overwhelmed by patients exhibiting flu-like symptoms. This outbreak has drawn comparisons to the early days of the COVID-19 pandemic, raising concerns globally. The Chinese government, on the other hand, has acknowledged the rise in respiratory illnesses, but has downplayed the severity, calling it a winter occurrence, and attributing it to seasonal flu and other common viruses. Officials have emphasized that the situation is under control, and that the number of cases is lower than in previous years. However, social media posts and local reports paint a different picture. Videos and images circulating online show crowded hospitals, with long lines of patients waiting for treatment. Some reports even claim that crematoriums are overwhelmed, with unverified accounts of increased deaths in certain regions. So, could this lead to another pandemic? While the situation in China is concerning, experts believe that the risk of a global pandemic is low. HMPV is not a novel virus. It has been circulating for decades, and many people have some level of immunity to it. Unlike COVID-19, which was entirely new to the human immune system, HMPV is more akin to seasonal flu in terms of its impact and spread. That said, the lack of a specific vaccine or antiviral treatment for HMPV means that managing outbreaks relies heavily on supportive care and the preventive measures we explained. Now we want to hear from you. Have you or someone you know ever dealt with a respiratory illness like HMPV? How do you feel about the global response to this recent outbreak? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.